Hello, Solified. Good afternoon.
Yeah, good afternoon, Ella.
Good afternoon. Good to have you today.
It's always a pleasure being here.
Okay, going to the next part, I have a healthcare expert on the show. We're joined by Dr. Oscar Mani. He's a healthcare system expert and currently a clinician in gerontology, working in long-term care settings in the United States. And he's with us here in the studio. Hello, doctor. Good afternoon.
Good afternoon, Ella.
Good afternoon. How are you doing today?
Awesome.
Good to have you.
My pleasure.
Okay, doctor, I want to say something before we start. The weather today is not friendly at all. Solified was really complaining bitterly when he entered. I want to hear what you think about it.
I have not truly experienced the weather. It's hot. It's not that humid. I was in a meeting just before I came here, the meeting that lasted for close to 2 hours, and we were semi-outside. Just now, I guess I got acclimatized for that 2 hours. So,
Okay.
to me, as I would always say, it's a thing of the mind. It's your mindset.
It's a thing of the mind. Well, that song is not really a mindset thing, no.
Which is something I experienced today.
It's not a mindset. It's far from a mindset thing. It's extremely hot today, anyways.
Very hot.
If you think about it and worry about it, you create more problems for yourself. If you accept it and think about other things not related to the heat that's been generated in your body, you wouldn't even notice. If you start to fan yourself, you are increasing the amount of energy expenditure in your body, and that fanning, the manual fanning, increases your perception of the heat. It doesn't reduce it. It doesn't make it any better.
Doctor, even as much as you try not to think about it, at some point you feel the heat. It's 33 degrees Celsius, feeling like 38 degrees. That's very, very hot. Even if you take your mind off it, as long as you're under the rays of the sun, you would definitely feel it. Definitely.
If you are moving and there's the wind coming in between, what makes you feel uncomfortable is the humidity. It's not the temperature. So the humidity can be as high as it is because there's a lot of water in the atmosphere. So it looks like you're boiling. You're in boiling water. Take your mind off it. Think of something different. No? And don't stay in one spot. As you're moving and doing things that preoccupy you sufficiently enough, you will think less of the adverse weather. There are some adverse weathers you cannot deal with. That's not a thing of the mind.
That's true.
If you are in extreme cold, the frostbite that you're going to get tells
terrible.
you that you need to get out of that weather.
Yeah.
Because your fingers, your toes, your lips all will be burning and you can't even feel your fingers. If you're in extreme temperature and you're not properly hydrated, you could die from that.
Exactly.
Because then you think you have malaria, but it isn't malaria. The only treatment you need is lots of water.
You're hydrated.
So for anyone who finds themselves out today and in these months in the hot sun, hopefully you are not wearing a suit and a tie.
You shouldn't.
Please don't.
What you need to do is drink a lot of water. No, just keep drinking. And of course you'll sweat a lot too, but if you don't want to sweat so much, don't drink rapidly. Take it in small sips. So don't take a glass of water and down it in one go, because 5 minutes later you will be using the bathroom and you pee it all off and you sweat it all off.
Yeah.
So the trick of drinking water to stay hydrated is to drink it in sips, in little amounts at a time. So if you have a bottle of water, instead of drinking it in 5 minutes, drinking in 30 to 45 minutes, you won't lose any of those waters.
Wow.
Yeah.
Although this is not what we're discussing today, but I think
know,
I learned
but it's-
something.
yeah,
I learned
it's-
something very, very good. And another thing, I think we're going to map out today to talk about mindset as pertaining to health on this show, because anytime we say something, you're always like, it's a thing of the mind. So definitely, we're going to look for a day to talk about mindset when it concerns health, honestly.
I'll be ready.
All right.
Yes.
So today on Bad Medicine, we're talking about HIV and lifestyle choices. How today's habits affect risk and prevention. And I'll start by saying that HIV remains a major global public health issue decades after it was first identified. And in 2024, about 40.8 million people were living with HIV worldwide, and 1.3 million people became newly infected. And around 630,000 people died from AIDS-related illness that same year. And since the epidemic began, more than 44 million people have died, and over 91 million have been infected. So today we're looking beyond the virus itself. We're going to explore how everyday habits, behaviors, beliefs, and choices influence risk and prevention. From misconception to testing to treatment, stigma, and lifestyle practices. This is about the real discussion that shape HIV. And we have Dr. Oscar Mani to unpack this all with us. Hello once again, Doctor.
My pleasure, I'm here.
Okay, I'll start by asking what exactly is HIV and how it differs from AIDS.
Okay. Those key facts that you outlined are very pertinent, except that I want you, the listener, to just think for a moment what 630,000 means. The number of persons that make up 630,000 will probably be more than half of Azwawa in Ikaland. So if you imagine the whole of Azwawa dying in 1 year from one condition, you begin to understand the scourge of AIDS or HIV. And again, just to further what you're saying, I consider HIV as bad medicine. That is what we should be really looking into in these kinds of programs. And for the large number of people that you have mentioned that have HIV, about 87% of them who have HIV know that they have HIV.
Yeah.
Incidentally, only about 77% of those persons are on treatment. So, where is the other 10%? Most of those 10% will be found in the African sub-regions, because Africa accounts for about 26 to 30 million persons with AIDS, accounted for in 2024, in line with what you were saying. So what is HIV and how does it differ from AIDS? HIV is a virus that causes immune deficiency in humans. It is spread in the body or through the body fluids of a person who has HIV in their blood. It can be spread through breast milk, through semen and vaginal fluids. There's still a lot of debate about whether you can get HIV from saliva. So the debate says no, that you can't have HIV, even though when you're doing some tests for HIV, you can also look for the virus in the saliva. So what the virus is a virus that attacks the white blood cells of the person who has it and destroys the white blood cells. What the white blood cells do in your body, you have the red blood cells, you have the white blood cells. The white blood cells are the soldiers. They are the ones who defend your body from bacteria, from infections, from anything hitting you. When you have a wound that's not healing, it's either your white blood cells are affected or the kind of blood supply that gets to that place is not sufficient, doesn't come enough with white blood cells. So your white blood cells are your defense mechanism other than your skin. So this particular virus will attack the white blood cells and will cause HIV. You become positive. Now, for you to say that you have AIDS, that is the advanced stage of HIV. AIDS is autoimmune deficiency syndrome. It comes with lots of things. The most things that happen is that conditions, diseases that you refer to opportunistic, what that means is a disease that will affect you because something is happening in your body.
Yeah.
It's easy to take root because your immune system, your defense mechanism, your soldiers are all gone. So to say you have AIDS, we need to count your CD4 T cells. You know, they are part of the white cells. Those are the particular cells that are attacked by the HIV. And so, if your CD4 T cells are less than 200 millimeters in the space, would say you have AIDS, irrespective of whether you have symptoms or not. So, of course, for you to know without doing that test, you see a picture of somebody who have AIDS, and you can tell by the time we describe what you're looking for. But the measure for AIDS is that your CD4 T cells are counted, and if they are 200 or less than that, then you're said to have AIDS. So that you have HIV does not mean that you will have AIDS. No. So.
Okay, is it when HIV is untreated that it generates into AIDS?
Yes.
Okay. All right, so let's, because of the course of this conversation, let's focus on, we're going to be focusing on Nigeria. You know, why is understanding HIV still important in Nigeria today?
I just mentioned that 65% of people, the whole world, that have AIDS are in the African sub-region.
Okay.
No, the African sub-region, which includes Nigeria, is also an area where healthcare is very poor. So a lot of people who are in this sub-region don't get the treatment. They don't have the access. They don't get the treatment. Of course, in developed countries, treatment for AIDS is free. You don't even pay co-payment to your insurance. But I don't think it's so in Nigeria. No, it's not. No. In many African sub-regions, you still have to pay to get treated if you have AIDS or HIV. So it is particularly important in these areas to prevent, because we can't afford it. There is no access, there's no affordability, there's no accessibility to healthcare that will prevent you from developing, from going from HIV to AIDS. Remember, we haven't said it, but we'll say it now. Once you have HIV, once you have that virus, you have it. There's no cure for it. You can only manage it. If you don't manage it right, it will go to AIDS. And once you hit AIDS, it's going to kill you. So it is very pertinent that in this part, in Nigeria particularly, and in African sub-regions, the right thing to do is to learn about how to prevent AIDS or HIV infection that will lead to AIDS.
Very important.
Yeah.
All right, Doctor, you mentioned it, I think, small, but what you wanted to elaborate on it. What are the main ways HIV is transmitted? And what misconception do people often have about the transmission?
All right, let's start with the misconceptions.
Okay.
You cannot get HIV from a kiss. You cannot get HIV from a hug or a handshake. You can't get HIV from mosquito bites.
Okay.
You can't get it in the toilet seat. You can't get HIV from dancing, even if you're dancing blues or close contact with somebody who has HIV. These are the misconceptions. People don't want to talk to you once they know you have HIV. They run from you, stigmatize you, because it's a one-way traffic. And so they won't even touch you. They won't even share food with you. No, you can get HIV from sharing food or drinks with somebody who has it. Of course, we naturally don't share drinks, but we share food. So those are things that people need to remove from their minds.
Mindset.
So, having said that, do you have any question before I continue?
No.
Doctor, are there ages that are more susceptible to HIV?
Okay, we'll get there. Let it be the last part. So how do you get HIV? Sexual contact. No, there has to be sexual contact or blood transfusion, or either contact with blood or semen. That is how you naturally get HIV. For people who practice anal sex, it's more, they are at a higher risk than people who only have vaginal sex. So, from sexual contact, that is when you have HIV, especially if it's unprotected sexual contact.
Okay.
People who don't use condoms, whether it's male or female condoms, are equally good to prevent you from having HIV. If you share needles, like those of our young men who are Of course, most Nigerian young men who are on drugs don't take the injectables, but I don't know the numbers. But if you are sharing needles or sharing syringes, chances are that when the person who used it last, one speck, one blood cell, would have remained stuck in the needles, and then you use that same needle without using your own a new needle, you are more than likely going to have HIV transmitted if that person has it. In them days, and I think it still happens periodically, blood transfusions in the hospital can give you HIV if it's not properly vetted in the labs. It has happened in the past, and people know that. You can get HIV from breastfeeding your child. The breastfed child can get HIV. So that begins to answer what age. So at childbirth, during pregnancy, during breastfeeding, because you can get it from the breast milk. So the child can have HIV transmitted from the mother if the mother is infected with HIV. So the age, any race, any gender, any sexual orientation.
As long as you're a human being.
As long as you're a human being.
Doctor, you made mention of anal sex and the vaginal sex. What about oral sex?
Yes, you can also
get HIV from oral sex.
Yes.
All right, doctor. What about using sharp objects like knives, razor blades?
Even clippers?
No.
Clippers included.
Clippers in the barber shop, you mean?
Exactly.
Yeah.
No, it's not been documented that good barbers, licensed barbers, always clean their clippers from one person to the next. Even their razors that they use to line, they clean it from one person. And again, modern barbing equipment don't truly cut your skin, so it doesn't draw blood sufficient to cause HIV transmission. So it's not been documented. The easiest way to contact like blood, if you have a sexually transmitted disease, for instance, and so it makes the skin mucosa to break, and you have a sore somewhere there, and you then have vaginal sex or oral sex or whatever kind of sex you have with somebody who has HIV, your chances of getting infected is higher because your skin is broken already. So that open wound creates a break in the barrier. The skin is the best barrier that you can think of if it's not inside of you. So those are the things that you need to be careful about.
Doctor, what would you say to those that, there's some people that go from street to street to shave people's hair, to cut people's nail with the same blade they use in shaving Mr. A, the same blade they use in shaving Mr. B. And the kind of shave is skin cuts. Most of the time you see their head bleed because of this same razor blade or sharp, whatever they use. And they use it on the next person and they keep using it. And people still patronize them till date. You see them walking and you call them, come and shave my hair, come and cut my nails.
No,
they use the same equipment.
Like I said, now, two things I've said earlier. Good barbers, and that means people who truly went to train as barbers know that they have to disinfect, they have to clean. Ordinary use of alcohol to wipe is sufficient. And that's one. Secondly, modern equipment don't truly cut you to the extent. No, you could shave your hair with 5 fast rotating blades and clean cut it, and there will not be one speck of injury.
Yeah.
The only time you might have bleeding is if there's an uneven, maybe somebody's growing a pimple or a bump right there that could cause that. But again, people going from place to place cutting hair, how sanitary is it? Now, you, the patron, who is the customer, you need to be discerning when you choose where you get your health care, because grooming is part of health care. If you are going to groom in the wrong places, people have been known to transmit HIV from tattoo parlors. Of course, tattoo is deeper than the haircut that you are describing.
Okay.
Haircut has not really been found to be guilty or as a source of transmission for
HIV.
HIV.
All right. So, doctor, some people will think, some people actually believe that HIV only affects a certain group. How does that misconception increase vulnerability?
That would be a very wrong approach to talking about HIV. I just said that it can affect anybody,
Okay.
from the one who's suckling their mother's breast to the adult. As a matter of fact, the World Health Organization recommends that if you are 13 years plus, between 13 and 64, you should at least have one HIV test to make sure that you are okay. So if you think that there are risk factors now, and the risk factors, if you think because you don't belong to that group, and I'm presuming that when you say certain group, you are looking at maybe sex workers, people who use the drugs. But I'm going to mention Arthur Ashe for people. I don't know if Solofite knows who Arthur Ashe is. He was one long tennis champion of the world.
Yeah, tennis champion.
Yeah, at the time. He died from AIDS. He didn't get it from being promiscuous. He got it from a blood transfusion in the hospital.
Oh my God.
So, those are things that can happen. And that's what an extreme. I know that because of improvements in healthcare and things, blood transfusions as a source of HIV transmission is reduced. I didn't say completely eliminated, it's reduced. So you cannot believe that there is one group. As long as you're human, you are likely to get caught. You find somebody who's bleeding and you didn't think twice. You are using your hands to stop the bleeding without putting on gloves, and you don't know the individual. If the person has HIV, chances are that you might have a bruise in your finger somewhere that you're not aware of, and the HIV virus can migrate from there into your skin, and you could get infected. So everybody is vulnerable. Anyone can be affected. Of course, like I said, persons who are high risk for HIV are people who use illegal drugs, and sex workers, people who have multiple sexual partners, people who practice anal sex particularly. Those are the people who are higher, have a higher risk of developing HIV infections.
All right, thank you so much for that, Doctor. Let's talk about peer pressure and cultural expectations or social norms, how they influence these risky behaviors.
Guy not there inside. No, if you are sexually active and you are in that age, that especially if you have multiple sexual partners, use condoms. No, they've been known to be 100% effective if you use them 100% correctly. So, no, there's a correct way to use condoms. There is an incorrect way to use condoms. So if you're using condoms correctly, chances of you getting infected is nearly zero. No. So there is no peer pressure that you should allow to change your path in life. For our communities here where we have no access, where we cannot afford treatment, that 5 minutes of peer pressure in the wrong direction can be the difference between you living a healthy life and being dead at 21.
Doctor, before you continue talking about peer pressure, it's looking like it's becoming a norm in this part of the world because there's the adolescent stage of life to adulthood. Some people around now, they disapprove the use of condoms and they tell it to their friends and they pressure their friends. If you talk to many of them, what you get is they don't like using it because their friends disapprove of it and they continue to disapprove of using condoms. They don't use condoms anymore because of the peer pressure that comes with it.
Any person who...
It's becoming a norm now.
It shouldn't be a norm. It's becoming a norm because people are largely uneducated and the other group are miseducated. No, there's a difference. No, ignorance or half knowledge, no, ignorance, uneducated, half knowledge or faulty knowledge, miseducation will kill you first, will enslave you second, and no, you can never come out of it. Sex, relationship between a boy and a girl is supposed to be private. Why should it be the consent of your peers? Why should you be talking about what you and your partner does in private or how you do it? If you do that, then you're not even mature enough to get engaged or to get involved in a sexual relationship. But again, no, having said that, we need to educate people on the dangers of being promiscuous, of having multiple sexual partners, of using drugs, especially if they are injectables. People must know that the dangers of AIDS from HIV is real. Several years ago, I was in this town having a drink with some supposedly elite people in this town who are educated, educationally elite, and one of those persons who happened to be a lecturer at that time at the College of Education came in and said, oh, he just came out of a conference on HIV and AIDS, and he declared that those things don't exist. And there was a crowd of college students and other persons who were there. I did not let it go.
Can you imagine coming from a lecturer?
Yeah.
I did not let it go. I stopped him. I didn't even let him finish making his pontification to say, hey, he was interpreting it as a way the Western world was trying to use to reduce our population. But HIV and AIDS are realities.
Yeah.
I have taken care of persons with AIDS. I see people with HIV. You don't want to see somebody who is suffering from AIDS. Everything happens to you. No, you are the most vulnerable person for diseases. Any infection hits you, it hits you badly.
Exactly.
You develop TB, you get what is pneumocystitis pneumonia, which is PCP. You get even cancer. Certain forms of cancers come from HIV infection that's untreated. Now, anything can kill you. Not only that, the killing, the weight loss that you're going to experience, the diarrhea that you're going to experience, the coughing, the night sweats that you're going to experience, the discomfort, the loss of your hair changes its texture. No, I'm talking about some black guy now, black person. Your hair changes its texture. Hard pull on your hair takes the whole hair out. No, it's not because you are getting radiotherapy. That is AIDS devastating your body. You see yourself wasting away, dying, the vomiting, the diarrhea, come on, it's not a pleasant sight to see. I'm sorry I'm saying it as it is, but people need to understand, and I'm not trying to frighten any person. I'm telling you that you do not want to have HIV, especially when you know that you cannot afford to get treatment.
All right, Doctor, still on the condom, what mistake actually reduces its effectiveness?
Improper use of condoms. No, there's a way to use condoms. Not after you are halfway into, then you start putting on the condoms. You have to be proactive about condom applications before the contact with the genitals, because once you have made the contact with the genitals, you don't know, you may or may not have transmitted HIV. So the best way is before. If it's a female condom, it protects both persons. It depends on who has it. So you have to appropriately use the condom.
And some of them might have ways of use written on their on the pack. So most of us don't care to read labels. We just take tear and use it the way it is.
And you cannot use one condom longer than you should. So if you are going to go round, you must change your condoms. That's part of the appropriate way of using condoms.
All right, thank you so much for that, Doctor. You can begin to send in your questions on the following numbers: 0916 2001019 or 0916 3001019, and the WhatsApp line is 0916 8001019. Okay, Doctor, why is HIV testing possible? Why is HIV testing after possible exposure critical, and what are the risks of actually delaying it?
Okay, let's go from back to front. The risk of delaying testing is that you will not know. Say, sometimes some people have HIV and they don't know because the symptoms are very similar to just like you have a flu. You might think it's just the flu you have, and if it doesn't develop into AIDS, you may never know that you have HIV, but you'll be transmitting it anyway. So you might be transmitting it without knowing. So if you think you have been exposed, there is what is called the exposure window. And now within that period, if you do it before the window, you might not find a positive result. So you will need to come back and test again. There are different kinds of tests to understanding whether you have HIV or not. There are some rapid tests, there are some lab tests. The rapid tests you can do at home, you get your results in less than 30 minutes. And so that's good because to a reasonable extent, people don't want to share that kind of information. Of course, in many societies, it's mandatory for healthcare workers to inform the partner if the person is married. You need to inform the partner that this person has HIV, and so the person can do things to protect themselves. And I want to say that you have HIV doesn't mean that it will kill you. You could die from other things. And in many cases, even those who have AIDS, it is the reducing of their immunity that causes other opportunistic diseases to kill them first. Mostly the pneumonia kills them. The cytomegalovirus makes some of them to die earlier too. But mostly, a lot of them get the TB, they get the pneumonia, and the pneumonia will finish you in a short period of time. So it's critical that you know that you have been exposed, because if you find out that you're positive early enough, you can begin your treatment before your immunity is reduced to such an extent that you develop AIDS. A lot of people, there are treatments, the combination of treatments, antiretroviral therapy. Your physician or whoever is caring for you will give you a combination of ARTs, that's antiretroviral treatment. And their goal is to suppress the destruction, the viral load. It reduces the amount of viruses that is found in the blood. So to so many of them, some medications that are available now in the United States are pills that you take once a month. So treatment for HIV has improved tremendously from when I was in the acute care setup. I mean, in the 90s, in the mid-90s, God, it was terrible. No, it was terrible. People, you could lose 3 or 4 people in one day from AIDS. There was no treatment. There was just no treatment. But today,
It's improved.
there's lots of treatments available there. They are expensive for people in this part of the world. People in the developed worlds, they don't pay for it. But those medicines seem to be quite effective because people are living longer lives now. They're even becoming, some of them are even able to be reproductive without transmitting the HIV to their partners. There are people who are living healthy lives. People who are Magic Johnson doesn't make a secret of it. If you know Magic Johnson, you are in the sports world sullified. Magic Johnson stopped playing basketball because he was diagnosed with AIDS, HIV. He's still alive. He's still healthy, healthier than many people. And 90% of the times he goes to test, his viral load is 0. So viral load is the amount of viruses found in a unit of blood. There's nothing in there. So he could say he's cured, but we know that there's no cure for it.
Yeah.
So you keep taking the treatment.
Like you said, you keep taking treatments.
Yeah.
There's no cure. Some time ago, you talked about when we discussed about cough. coming with flu. You say it's a viral infection that it comes and goes on its own. So why is that of HIV not going?
Because your immunity, your defense system, your soldiers are gone. They killed all of them.
The HIV itself.
Yeah, the HIV killed all of them because that's what it's interested in. Kills all your soldiers. Whatever was going to provide you with defense. So you have no defense system. So when you are being treated with antiviral medicines, the goal is to reduce your viral load, kill those viruses, put them to such a number where they are not even seen in your blood. At that time that they are not seen in your blood, you cannot infect anybody.
But you have it.
But you have it. Because the virus, there's no cure for viruses. We have not developed a way to kill viruses yet. I don't know why. But the goal is that by the year 2030, it will become HIV viruses will be extinct, that will eliminate them. 2030 is 5 years from now.
Yeah.
So I don't know, but we'll see what happens.
All right. At this point, we're going to open the phone lines so the listener can be a part of this conversation. The numbers to call are 0916 2001019 or 0916 3001019 and the WhatsApp line 0916 8001019.
Good afternoon.
Hello.
Good afternoon.
Good afternoon. My name is
Okay, welcome to the show.
Kalmaka. Please, doctor, there's one word or two words that we are hearing in this our Africa or Nigeria, that the cause of HIV is as a result of female, our female women having sexual intercourse with male
With what?
dog.
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 Right.
Dog.
No.
Whether they were making one, those develop one, and get money, bring their them, but it's double. Now they prepare the money. Is it true?
No. It's not.
No.
It's not true.
Straight answer.
And the second one,
General, your line isn't so clear.
It's really
We're
hard
finding
to
difficult
hear
in what
you.
you're saying.
is not bad.
Can you please?
Okay, you have to call back. We can barely hear what you're saying. The numbers to remain 0916 2001019 or 0916 83001019 and the WhatsApp line is 0916 8001019. Hello, good afternoon. Hello, good afternoon. Okay, please call back. Hello, good afternoon. Good afternoon. Welcome to the show. Hello, can you hear me? Go on, we can hear you. What's your name?
Yeah, my name is Cliff.
Okay, let's hear you.
So this HIV matter is really getting out of hand. And people really have a role to play in this HIV issue. Because I have a friend back there. This boy, every hook he carry, he sleep with their rope. Are you hearing me?
Yeah, go on.
So all those things they used to carry along there. So he used to sleep with them with Akwadon. So that was one of the reasons I avoided the guy. So and we have many of the ideas. Such boys like going around, sleeping around without protection, and it's very bad.
Okay.
It's very, very bad. So men should work on themselves.
All right, thank
And
you.
you should know that this HIV is very deadly.
Thank you for calling. Okay, we have a message here. This one says, how effective is PEP, post-exposure prophylaxis?
It's been known to be effective whether or not you have HIV. Now, if you think you've been exposed and you are not very certain for yourself, you can take the post-exposure prophylaxis. They are known to be effective, and so people do that, especially when they have engaged in unprotected sex.
Okay, all right, thank you for that. Keep the calls coming in on 0916 200 1019 or 0916 300 1019 and the WhatsApp line 0916 800 1019.
Good afternoon, it's Lick FM.
Good afternoon, Doctor. Good afternoon.
Good afternoon. Welcome to the
Prince
show.
calling you from Convent Street.
Welcome, Prince.
Yeah, Doctor, how safe are some people who actually help accident victims? Because you don't actually know who is having HIV. Most times you see people gather around accident victims and helping them out, and you see those who are helping them, their body are filled with blood. So, because you know Nigeria, this is where we are. Before those people who are supposed to do this will come, those people might die. I see people trying to render, helping hand to these accident victims. So how safe are they,
Right.
considering the danger of this HIV disease?
They are not safe at all if there's blood involved. You asked a very, very important question, a very troubling question. I don't even know how to answer you, because you are exposing yourself. If the person is bleeding and you don't have any rubber gloves, look for bread wrapper. Those nylon, they take wrap bread. It's better than using your hands directly. Find something to protect your hands. The blood splashing on your body is not likely going to hurt you, but your fingernails, if you have a cut that you don't know of, it becomes increasingly risky when you help. It's tough to answer because we still need to help our people.
Yes,
Yeah.
we do.
But we need to also find a way to protect ourselves, because you don't want, in the process of helping somebody, get a problem that you cannot actually deal with. So it's quite dangerous, it's quite risky, but we still got to do what we got to do. So
Yeah.
at the very worst, wrap your hands with a lot of clothes so that the blood, if there is any, doesn't get to your skin. That's the best approaches. Otherwise, if you're somebody like me who always has a box of gloves in their vehicle, you don't have much to think about. But how many people are like that? No.
That's the question.
Yes.
Okay, we lost this call. Keep the calls coming in 0916 200 1019 or 0916 300 1019 and the WhatsApp line remains 0916 800 1019. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Welcome to the show. Tell us your name.
My name is Daniel.
Okay, let's hear you.
Yes, I quickly want to share my experience.
Your place is quite noisy. I don't know if you just phone on speaker or are you close to your listening device.
Okay, what I'm trying to do is that I'm a medical personnel. I just want to share
Please
what-
move away from your listening device. We can't hear what you're saying. Move away from your listening device. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Welcome to the show.
Well, thank you. Please, I have a question to ask. If, for example, that somebody that
We can barely hear what you're saying. Please be audible.
Hello,
We can barely
Yeah,
hear what
go
you're
on.
saying. Your voice is so faint.
can you hear me now?
Yeah,
Better.
yes, go ahead.
Okay, I said if somebody that has this virus, so how can the person now prevent it from the children?
Yes, if you have the virus, go on treatment. Like what I'm saying, if you have the virus and you're on treatment, the ARTs, it will reduce your viral load to such a number that you will not transmit it, even though you have it. But before you get your viral load to those low numbers that the goal will be, you can protect your family by not exposing them to your body fluids, blood. Of course, if you're a woman, you don't need to breastfeed your child if you have it. You can always use milk, no, artificial milk to raise that child. And no, if there is a cut, if you have a cut, and don't let your family members get in contact with the blood.
All right, let's take this call. Hello, good afternoon.
Yes, good afternoon. My name is Daniel.
You're still close to
Your
your
radio is
listening
on. Off your
device.
radio.
You have to turn off your radio so we can hear you.
Person.
Okay, I just quickly want to share an
Turn off your listening device so we can hear you, please. Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Welcome to the show.
This is Baba Yellow.
Okay, let's hear you.
Okay, I want to ask the doctor, from the time of contact and the time he start to show different types of symptoms, how long will it take?
Normally, you should. Sometimes you don't even have symptoms, but if you do, no, if you go and do a test, the earliest time that you will see anything at all for any of the tests will be at least 10 days from the time you were exposed. So if you were exposed and you go on day 6 to do your test, any test that you're doing, no, some tests will not show you any result till about 18 days. Some, 10 days, 18 days, no, but if you are doing the lab test, which is the NATs, 10 days is the earliest that it will show in your blood. If you go before then and they give you a negative, know that you are still within the window period where you can still think you're free. Go back and do another test.
Does it mean that not everybody gets symptoms?
Yeah,
If they are,
yeah,
what
yeah.
are the few symptoms that people that get?
I've listed them 10 times already. No, flu-like. No, you get cough, you get nice sweats. By the time you start losing weight, you are going into AIDS. So with HIV, you may not have any symptoms. You just have that fever. You think that it's fever.
Just normal fever.
Yeah. So
All right, Doctor, I'll ask this question. So what practical lifestyle changes can reduce the risk of HIV for people in their daily lives?
lifestyle changes, like the young man who talked about young men who do take risky behaviors, you know, who don't want to use condoms, and those who want to keep multiple sex partners. That's a lifestyle choice. You should know the dangers of what you are getting into. So the lifestyle choices that you can make to help you reduce your chances of having HIV includes how you choose your sexual partners. If you find that your partner has other partners, now it will be time for you to start thinking about protective sex and protective relationship, or even if you want to continue in that relationship. So you need to be careful with multiple partners. I mentioned in passing that if you are 13 years to 64, periodically you can just do at least one HIV test to make sure that you are free or not infected, and then you can continue to protect yourself. The way you eat also will help you. You need to learn to eat healthy. We talk about healthy eating in almost all our programs. The most, if you're using illegal drugs and you can't help it, try and afford new syringes. Don't share needles with people. Don't share needles or syringes with people. Just take your own thing. Get your own, at least spend some part of your money as you're buying the drugs, buy enough syringes that you can use. For sex workers, most of them know what to do, but they still need to protect themselves and protect their customers. Of course, sex work is illegal, but in many places, but we know that there's nothing you can do to completely remove it from societies. There are people who do that because they have customers. So it's a two-way thing. Again, those persons need to know how to protect themselves when they're having sex. Anal sex, oral sex, things like that. If you have a sexually transmitted infection and you know it, avoid your partners. stay well, heal yourself or take care of that STI, and I'm talking about things like gonorrhea or syphilis or things like that. Make sure that you take care of that, because if you have that with HIV, it's going to increase your symptoms and it's going to increase your chances of developing AIDS. So those are the things that one needs to think about. Your behavior matters. If you are one of those who drink, get drunk, and go home with somebody, for a nice stand that you don't know, you need to modify that, because you increase your chances. Your risk factor gets much higher than it should be.
Doctor, the pregnant women that deliver their children, and their children are most times HIV free, is it because their viral load has been reduced to either zero?
HIV positive pregnant women,
yes.
Talking about. Yes. The viral load is next to nothing. So that helps. But there are some that the child can miss it when they are passing through the bed passage and get it through breast milk. So you still need to think about breastfeeding the child. So, but if the child doesn't get it after passing through the bed passage, chances are that the child will not get it, because the viral load for the mother is very low.
For those that are infected, what would be your advice to them? How accessible are the treatments here in Nigeria?
I don't know truly how accessible the treatments are in Nigeria. I truly don't know. But I hear that in the big cities, in Lagos areas and in Abuja, you will be able to get the HIV clinics where you can get treated. But Nigeria is also part of the World Health Organization, and they get funding for HIV treatment. So I am optimistic that they are doing the right things in the right places. But again, for those who don't have it, and for even those who have it, the biggest thing that we need to do is raise awareness and keep raising awareness that this is something that is real and that it has no cure, but you can manage it and you can prevent it.
All right. Thank you so much for that, Doctor. Okay, this message is quite long. Don't you think it's important to have first aid boxes in case of accidents? The first aid boxes are equipped with medical glove for protection. Secondly, what you said about terminating your immune soldiers, I think it's impossible for someone to procure AIDS cure, because that would mean manufacturing drugs. And that, this one is quite long. I think we'll just wrap it up.
No, read it. Let's see.
Okay. This one says, do you think, secondly, from what you said about AIDS terminating your immune soldiers, I think it's important for anyone to procure AIDS cure, because that will mean manufacturing drugs that has resurrection ability for immune soldiers in the blood, and that will be playing God with science. Don't you think so, Doctor?
No. You don't understand how the white blood cells are continually produced in the bones, and the blood cells in the liver, and so it's not like once it kills them that they can't grow. They do grow. No, your blood cells die within 120 days. Every 120 days, you have a new set of blood cells, both red and white blood cells. So it's not like a one-time all that once it kills those soldiers, they won't be recreated. So even those that are coming alive, as long as the HIV virus is there and it's not going anywhere, it will keep knocking off those white blood cells. And this first part, it talked about first aid kits. If you listen to me, I told you that I always have a box of gloves in my car.
That's true.
No, I have a first aid box in my car. So it's something you can do, but your first aid box is always for one-time use. So once you use it, it's not even going to be sufficient for you to finish that in an accident. So you need to replenish it. You need to change it. No.
All right, thank you so much for that, doctors. We have lots of call and messages coming in. I wish you had time to take that, but I'm so sorry we can't take it. We're out of time. Thank you for staying with us. Thank you, Dr. Oskamani, for joining on Bad Medicine Show. And don't forget, the show comes up again next week, Saturday at 2 p.m.
Sleek FM.
What's up, everyone?
The best in African tunes.
Are you looking for admission into a polytechnic or university? Look no